with all of the housekeeping points covered, I just wanted to take some time to introduce our speaker for today. So today we have with us Dr. Sheila Turbot, and Sheila is a registered psychologist with the College of Psychologists of Ontario. And so after completing an internship in behavioral medicine at the London Health Sciences Centre, Dr. Turbot went on to hold professional positions with Marion Joy Rehabilitation Hospital in the Greater Chicago area, Trillium Health Center, and the Peel Regional Cancer Center at Credit Valley Hospital. Dr. Turbot also has a private practice.
And thank you everybody for being patient. Technology is not cooperating at the moment. So I am going to be talking about cancer and trauma, and just to give you a little overview of what I'm going to speak about today, I'm going to start off with talking a little bit about what is trauma and how we define it. And then I'm going to talk a little bit about what traumatic events are and how cancer might be viewed as a traumatic event. Then I'm going to discuss, how we differentiate between a traumatic event and a clinical disorder of trauma. And then I'm going to talk a little bit about cancer-related PTSD, which is the clinical disorder, the prevalence of cancer-related PTSD, risk factors for cancer-related PTSD, and then I'm going to spend the remainder of the time focusing on how we cope with trauma symptoms or cancer-related PTSD, if it's the actual full-blown clinical piece. So I'm going to change slides now, and I'm going to pause for a moment so that the slide has a chance to come up. So the first thing that I want to just talk about is what is trauma. And basically what we are looking at, if we look at the event itself, we basically look at a traumatic event as a deeply distressing or disturbing experience. I think the next piece that we're going to look at is a couple more definitions of what is trauma. So I'm on to the next slide. So I'll give you a moment, hopefully that you can see that next slide. And in this case, looking at some more definitions of trauma, this is looking at sort of the response that we have to a traumatic or distressing event. So CAMH has the definition where they look at trauma as a lasting emotional response that results from living through a distressing event. Another definition is trauma being defined as the direct reaction to a stressor that exceeds the individual's capacity to cope. So I think, the theme that we're seeing in all of the definitions is that it's an event that causes distress and that there's an emotional reaction. So the next slide, hopefully you can see it. The next question we have is the question of, is trauma normal? And trauma is an emotional response that someone has to an extremely negative event. So yes, that is a normal reaction. However, the fact that the person's experiencing a very negative event is not necessarily normal. So why do we need to talk about trauma? We need to talk about it because the effects of trauma can impact a person's quality of life. And in some cases, if it's the clinical disorder of trauma, it can actually have such severe effects that they interfere with the person's ability to live a normal life. So I'm going to talk a little bit about what traumatic events are. And as we've just talked in some of those earlier slides, traumatic events by definition are distressing or disturbing to the individual experiencing them. And examples of traumatic events may include a recent single traumatic event like a car crash or an assault or a diagnosis of a life-threatening illness. Traumatic events can also include single traumatic events that occurred in the past. And those could be, again, an assault, the death of a loved one, an accident, or living through a natural disaster or a war. Another group of traumatic events is when it's a long-term chronic pattern of events. And examples would be ongoing childhood neglect or ongoing sexual or physical abuse. So the question that I want to bring up for everyone is the question of, can cancer be viewed as a traumatic event? And the answer to that is absolutely. A cancer experience often incorporates a series of potentially traumatic events. And if we think about the cancer experience as ranging from detection all the way to treatment and side effects, we can see that there's probably a number of different potentially traumatic events along that trajectory. So if we look at the first phase of detection, in that situation, people are going to be experiencing a lot of fear and uncertainty. And of course, you know, the fact that they are experiencing those in response to the event of something coming up, something abnormal, something that's been brought to their attention, can be potential for a traumatic event. Investigation. So in this phase, a lot of times people would be waiting for test results or waiting to hear the outcome of tests that they've had. It can be very stressful, very anxiety provoking, and of course it brings up a lot of uncertainty. And so you can see potential here again for this being traumatic event. I think everyone would agree that a diagnosis of cancer has significant potential to be a traumatic event. One of the things we know for sure is that a diagnosis of cancer undermines a lot of the assumptions that we tend to live with, the assumptions of invulnerability, predictability, and control. And when we have a diagnosis of cancer, it sort of shakes up all of these assumptions, and we can end up, you know, feeling vulnerable, feeling uncertain, and feeling a lack of control. And you can see that there would be opportunity or potential there for that being a traumatic event. With treatment, another phase in the cancer experience, we can see that, you know, in this phase, there's often a great deal of information that has to be processed, and that information is many times very new to people and in a language they don't necessarily understand or are not familiar with. So it can be very overwhelming. Oftentimes decisions have to be made, and those can be very significant, sometimes, you know, impact the quality of the person's life or the length of their life, that decision making. So it's extremely serious decision making. And of course, that can lead to feelings of uncertainty and stress and being overwhelmed. Treatment also at this phase can include a wide range of procedures that may follow all of that decision making and information processing, that once those decisions are made, you may actually engage in the treatments, and there can be a wide range of treatments. And you can imagine that based on the fact that there's so many different treatments and people can have very different responses to treatment, there's potential here for those to be traumatic events. Another piece during treatment that is kind of unique to cancer is that during treatment, individuals often are going through treatment with other people. So they may be seeing the same people week after week, or seeing the same people from appointment to appointment that are sort of on the same schedule. And oftentimes they get to know these people. And so sometimes there's potential that people can actually witness other patients' adverse experiences or other patients having, you know, side effects happen in their treatments. So that brings me to the next slide, which is talking a little bit about the side effects of treatment. Of course, I'm sure everyone is aware that there's side effects possible with cancer treatment, and there can be, because there's a wide range of treatments, there's also a very wide range of side effects. Many of those side effects can be physical, but they can also be emotional, and by emotional, you know, the wide range of emotions that we can feel as a result of going through treatment. And they can be psychological, where we can actually experience, as we're talking about today, trauma, but also low mood, anxiety, changes in self-esteem or self-worth, and there's many more. So I think, in summary, we can see that there's, through the cancer experience, there's a number of different potential ways that we could experience traumatic events. So that brings me to the question of, is cancer diagnosis and treatment traumatic? The majority of people with cancer, the majority of people who have a cancer diagnosis and treatment experience it as traumatic. So that's basically saying that, I don't think anyone receives a cancer diagnosis or goes through treatment for cancer without having some sort of an emotional reaction. Many cancer survivors report one or more symptoms of trauma. However, the majority of cancer patients do not meet our clinical level of trauma, which is the DSM-5 criteria for PTSD or post-traumatic stress disorder. So they don't necessarily have the range of symptoms or the number of symptoms that would be needed for what they're experiencing to be a clinical diagnosis. However, it's very important to recognize that almost every person who goes through a cancer diagnosis and treatment is going to experience some level of trauma or some trauma symptoms. So what makes events traumatic for some people and then not for others? So the idea of what tips the scale, that some people are going to experience an event as traumatic, whereas other people may not. And it's really about how the event is experienced by the individual. It's that person's subjective or personal experience. And it's more likely that the person is going to experience that event as traumatic if they feel a sense of helplessness or a sense of horror in reaction to that event. So when we talk about that clinical piece of trauma, I want to, be clear and define for you what the clinical diagnosis is for post-traumatic stress disorder. Now, remember, not everybody is going to experience a clinical level of trauma, but many people are going to experience some symptoms of trauma. So this clinical level of trauma, of what we call PTSD or post-traumatic stress disorder, is an anxiety disorder. And there are very specific criteria or symptoms that people have to experience in order to be diagnosed with this, this disorder. The first, which I think, most people are aware of and understand, is that they have to have experienced a traumatic event. And that event has to have been threatening to them in some way. So threatening to their own life, or that event has to have occurred in front of them, or that event has to have occurred to someone that they love, or they've heard about the event occurring to someone that they love or care about. And they have to experience, as I mentioned, just a few moments ago, they have to experience those feelings of helplessness or those feelings of horror in response to that event. So that's sort of the starting point with this clinical diagnosis. The next group of symptoms for this clinical diagnosis are what we call the intrusive symptoms. And I'm going to talk a little bit more about those with the next slide. The third group of symptoms are the avoidance or numbing symptoms. The next group are the mood or cognitive symptoms. And then the final grouping of symptoms are the arousal symptoms. And I'm going to talk about each one of those in just a moment. PTSD impacts a person's sense of safety, their sense of self, and their ability to regulate emotions and navigate relationships, which is why it's considered to be a significant clinical disorder when it affects all of these aspects of how somebody feels, how they feel about themselves, and how they're able to interact with people around them. So let's talk about some of the symptoms of PTSD, but these are also symptoms of trauma. When we talk about intrusive symptoms, we are talking about memories of the event, flashbacks of the event, nightmares that people experience where they're dreaming of the event, and also what we call intrusive thoughts or images, which are thoughts that pop up in someone's head or images that pop up in someone's head that they find very difficult to control or to push away when they pop up. The numbness or avoidance symptoms are talking about the fact that with PTSD or with trauma, like with trauma, many people start to develop patterns of avoidance. So for example, if the traumatic event for someone was a car accident, many people who are experiencing some trauma symptoms and maybe some avoidance symptoms may start to avoid driving their car or riding as a passenger in a car because they've had this traumatic accident. Those are what we would be talking about when we talk about avoidance symptoms. The next group of symptoms is look at sort of concentration and focus, and the fact that our concentration and focus can be reduced when we're experiencing trauma symptoms. And when our concentration and focus are reduced, it increases our risk of accidents or our risk of being forgetful. Another group of symptoms are the feelings or the changes in mood that people may experience. So this could be feelings of fear, feelings of anger, feelings of guilt, horror, or terror, as well as feelings of sadness, and sometimes even feelings of failure. Another group of symptoms that are very important when it comes to trauma are feelings of detachment or isolation. And detachment means people start to feel less connected to the people around them. That might be their family members, it might be their friends, it might be their work colleagues, but people that they used to feel a sense of connection with, and they start to feel that less of that connection and more detachment. And then sometimes because of some of those feelings that the person may be going through, if they're irritable or angry or frustrated more often, they may start to self-isolate as well. And so there can be feelings of isolation based on what they're feeling and their own behavior patterns. And there can be feelings of isolation that other people may not understand what they're going through. The last group of symptoms of trauma that I want to talk about are the hyperarousal symptoms. And these symptoms are symptoms that indicate to us that your nervous system is on high alert, or as I have on the slide here, sort of in a red alert status. It means that your nervous system is turned up high and is very reactive. So we can get symptoms of restlessness, irritability, sleep difficulty or dysfunction, and people being jumpy or easily startled. And these are all what we call the hyperarousal symptoms. So to bring cancer back to this PTSD or clinical disorder, I think we want to I want to introduce this idea that there's also something that we call cancer-related PTSD, which is the development of PTSD or the clinical trauma disorder in response to a cancer diagnosis. So you may be wondering, how often does this happen that people actually experience this clinical disorder, PTSD, in response to a cancer diagnosis? And the literature, the research tells us that that can be a very wide range in terms of what we can see as prevalence. So it can range from 3% right up to 22% of people experiencing PTSD. But as with many things, there's quite a range, but most of the studies, most of the research reports that cancer-related PTSD happens in about 4 to 6% of people diagnosed with cancer. So it's not a huge group, But again, to the reason we're talking about this today is not necessarily because of that 4 to 6% who meets the criteria for the clinical disorder, but we're talking about it because nearly everyone who has a cancer diagnosis and who goes through cancer treatment will experience some trauma symptoms. So they may not be in that 4 to 6% with the clinical disorder, but many people experience trauma symptoms. So what are risk factors for cancer-related PTSD or experiencing trauma symptoms from a cancer diagnosis? And so some of the risk factors that we know about would be having a pre-cancer history of trauma or a pre-cancer diagnosis of trauma. Another risk factor would be low socioeconomic status, which means that you know, with the low socioeconomic status, there can be multiple stressors in someone's life. And so that can add to the risk of experiencing cancer diagnosis as traumatic. Being younger, having limited social support, or having negative social support. Having more advanced disease, having more invasive treatment. A few more risk factors on this next slide. Having more than one cancer recurrence. Having a sense of dissatisfaction with your medical care. Experiencing what we call dissociative symptoms regarding your cancer experience. And this is one I hear quite often from people, that especially if their cancer diagnosis has come as a shock to them. They weren't expecting it at all. They didn't, it really wasn't something that they were contemplating. And sometimes they can have what we call a dissociative experience. And that's, the example here would be that, they can't even remember being in the office with the doctor when they're being told that they have cancer. They can't remember it. They can't recall the details because their sort of nervous system or their mind sort of shut that down for them. The opposite of that experience is what we call persistent intrusive re-experiencing of that diagnosis. And this is another one that I also hear often in my practice, which is that hearing that cancer diagnosis for the first time is something that people often will find traumatic and will replay over and over in their head. Or that can be the case with other difficult experiences they've had along that cancer journey. And we talked about that a little ways back, where we were talking about all those different phases of the cancer experience and where there could be potentially traumatic events. Those sometimes can be re-experienced for people if they have a particularly negative experience, with diagnosis or with treatment or with a certain side effect. So now we're going to shift gears a little bit, and we're going to start to talk about how do we cope with trauma symptoms. We're going to talk about a number of different pieces of this coping, and we're going to start with talking about education. So it's very important that we recognize that experiencing trauma symptoms is not necessarily something that people are going to have faced in their life before. Some people will, but not everyone. So for some people, a cancer diagnosis may be their first experience of a traumatic event. So it's important that you learn about what you're experiencing and learn about what this trauma is and what it is not. As we mentioned earlier, the reaction to a distressing event, having an emotional reaction to that is normal. So trauma is normal. The fact that, trauma can be managed and it can be controlled is also very important to know. It's equally as important for people to understand that trauma is not weakness, it is not failure, and it is not a sign that you're going crazy. Those are just some very important distinctions I wanted to start out with in terms of education. Another piece that I wanted to talk about is seeking out resources to learn as much as you can about trauma if you feel that you might be experiencing some symptoms of trauma. And there's some excellent resources that you could look at. One would be Anxiety Canada, and I've included the website here. They have excellent resources regarding PTSD and trauma. The PTSD Association of Canada is another one. The Center for Addictions and Mental Health, which is called CAMH, they have programs to help people learn to manage and control their trauma symptoms. And they have a great deal of information on their website as well. And then finally, the Canadian Mental Health Association. They have very helpful information on PTSD or post-traumatic stress disorder as well. Continuing with this idea of education, another avenue that a lot of people find helpful in terms of learning about trauma is looking at some of the self-help books, or in particular, some of the PTSD workbooks that are available from bookstores. So you could probably, you definitely can get these from Indigo Chapters, but you could also probably get them online from Amazon or different places like that. But looking at PTSD workbooks, which are focused on strategies and techniques for managing symptoms. And you'll see I've listed a few here, and these ones, particularly the first one, I think is on its 3rd or 4th edition. So it's a very well-known and very popular and effective workbook for PTSD, and that's the one by Mary Beth Williams. So going on to our second step with coping with trauma symptoms, one of the things that's extremely important is for people to be aware of unhelpful behavior patterns that can develop. I talked a little bit about these when I was talking about symptoms, but this is something I want people to be aware of in terms of their own coping, that we need to be watching for patterns of behavior, watching for patterns of avoiding fearful stimuli or fearful situations, and not allowing ourselves to fall into that pattern. The reason that we don't want to fall into this pattern is it can lead to increased symptoms of trauma. A second pattern that we don't want to have develop, or that we want to be aware of, is developing a pattern of isolating or withdrawing. I mentioned this as well when I was talking about symptoms. And again, sometimes these patterns can be subtle in how they develop. And so we want to be aware of these as possibilities, and we want to try to make sure that we're not sort of accidentally or unconsciously falling into some of these patterns. So even though we may be feeling as though, you know, we're irritable and we're frustrated and we don't want to be around people, we need to be aware of not isolating ourselves and trying to push ourselves to connect at least with some people, even if that's only 1 or 2 people that you feel comfortable with. That's better than isolating completely. The third pattern that we have to be very aware of that can happen with trauma is that sometimes people can, again, develop a pattern of turning to substances such as alcohol or drugs to try to manage the trauma symptoms. And it's really important that, again, people are aware of this as a bit of a vulnerability, and that we don't want this pattern to develop because it can obviously lead to other problems like addiction. I'm going to move on to talking about the third group of coping strategies. And in this group, it's about challenging the feelings of helplessness that can come with symptoms of trauma. So in this group, we want to learn about exposure therapy, which is a process of gradually being exposed to feared situations or avoided situations. And oftentimes this is done in therapy with a mental health professional, but it's also something that people need to be aware of, again, to sort of challenge that pattern of avoidance that can develop. And the way we challenge that pattern of avoidance is we try not to avoid, or we try to face some of those fears. Another area for challenging helplessness is looking at some ways to empower yourself. And some of the ways that we can empower ourselves is by focusing on factors that are in our control instead of factors that are not in our control. So when we look at factors within our control, sometimes we can look at, focusing on things like nutrition or exercise. There may be other things that people feel are in their control. They may decide, how they want to structure their day, what activities they want to do on some days and not on others. So scheduling might be something that's in their control. Another area that is particularly important is setting goals. Again, setting goals and attaining those goals, for most of us, that brings a sense of productivity and a sense of accomplishment. And those are in direct challenge to a sense of helplessness, because when we feel productive and we feel accomplished, we're not feeling helpless. Sometimes helping other people can bring about some of those same feelings of productivity and accomplishment. And it can be rewarding sometimes for people to help others. In particular, when people have dependents or children that they're looking after, that can be something that helps to empower them, because they understand that there's people counting on them and that they want to fulfill those responsibilities. So that's empowering for a lot of people to know that they can meet those demands or fulfill those responsibilities. And then another way that sometimes people can empower themselves is volunteering. And again, that's sort of a subset of helping other people or helping the community, the larger community. A fourth area that we want to focus on when it comes to coping with trauma is focusing on calming your nervous system. And what this refers to is, if you remember when we were talking about symptoms of trauma, often people experience what we call the hyperarousal symptoms. And so those are the symptoms where your nervous system is on high alert. And that is a very common experience for people with trauma. So we want to make sure that we're taking action to try to calm that nervous system down and to try to move that nervous system out of that high alert state. So some of the ways that we know help us to do that are engaging in relaxation strategies, meditation, or mindfulness strategies. And I think most of you are probably aware that Wellspring has programs that look at all of those different pieces, at relaxation, at meditation, and at mindfulness. And so there'd be opportunities to build your coping in those areas through some of the programs with Wellspring. There's also many, many resources outside of Wellspring as well for meditation, for mindfulness, for relaxation. Another piece I want to mention in this group of calming your nervous system is spending time in nature. And that might seem a little strange to people, but being in nature or being, around, living organisms, I guess, not the right word, but it brings a sense of relaxation and peace for a lot of people. And so one thing that I often talk about with people is seeking out local organizations that offer outdoor recreational opportunities, or seeking out those opportunities on your own. So I know those aren't necessarily easy to do right now during a pandemic. However, you know, instead of going for a walk down a busy street, you know, is there an opportunity to go for a walk in a park? Or, you know, is there an opportunity to sit by a lake or sit in a park, or even in your own backyard or in your own garden, where you're surrounded by plants, where you're surrounded by the sounds of, you know, birds, or the sound of wind going through leaves or trees. All of those things tend to be quite calming. A fifth area that we want to talk about in terms of coping with trauma symptoms is seeking out ways to move your body. So some of these ways to move your body may be more calming activities, such as yoga or Tai Chi. These tend to be slower movements. These tend to be, you know, more precise movements. And both yoga and Tai Chi are coping strategies that you could look into through Wellspring. Another area that can be quite helpful when it comes to sort of moving your body out of this high alert state or these arousal symptoms is rhythmic exercise. And that's exercise that involves both your arms and your legs, such as walking or running or swimming or dancing. And focusing on your body and how it feels when you move in these ways can help your nervous system to move out of that high alert state and become sort of turning down that alertness and turning down that reactivity. For some people, higher intensity exercises are helpful for this same reason, to turn down that high alert state that they feel. These higher intensity exercises, though, require quite a bit of focus and concentration. And so they can be helpful, but they do require people to be very focused on their body and to be very focused on what they're doing in these activities. Because if they're not focused, there's potential for them to get hurt or to come to harm. So those ones might not be for everyone, but for some people, they really do help. Another area that we have to think about and talk about is working on your sleep routine. So healthy sleep habits are also called sleep hygiene. And Anxiety Canada has some good resources regarding sleep hygiene. And this is really talking about developing good sleep habits and a good sleep routine. Now, good sleep habits can be things like, only using your bed for sleep and not doing work sitting on your bed, or, not spending time in your bed when you're not sleeping. Other good sleep habits may be, making a point of turning off screens, for a period of time before you're going to try to sleep. If you look into it, you'll find that there's quite a bit of information available about what are healthy sleep habits. Another piece to this, though, is really, I always say to people, it's a bit of trial and error, but really trying to work on your own bedtime routine and trying to make it a routine that helps you wind down, helps you release tension, and helps you, enter into sleep in a more relaxed state. So things that you may want to include in your bedtime routine would be, meditation, or listening to calming music, or reading something light, or engaging in a relaxation strategy or a breathing strategy. Those might be components of your bedtime routine that help you to unwind, to help your body to relax so that you can fall asleep faster and stay asleep longer. Another area of support that's particularly important, or of coping that's particularly important, is seeking support. Now, if you remember when I was talking about some of the symptoms and some of the patterns that can develop with trauma, is that sometimes people can start to isolate. And we know that can lead to an increase in symptoms for some people. So we really encourage you, in terms of coping with symptoms yourself and coping with trauma, to seek out support. And that could be joining a support group. You know, there's many support groups available through Wellspring. It could also be seeking out support for trauma, like so with a trauma support group or a PTSD support group, or other types of support groups. It could be seeking support by taking part in a class or a workshop where you're engaging with other people. It could be seeking support by confiding in a person that you trust or spending time with friends and family. And of course, seeking support could also mean, speaking with a mental health professional if you're experiencing, maybe significant symptoms of trauma or many symptoms. And that brings me to the last point that I have with coping with trauma symptoms, is sometimes it is very helpful to seek out professional help. And that could be seeking out, an assessment to see if your trauma symptoms or what you're experiencing, if they do meet that clinical level, and if maybe you need to engage in, therapy that's focused very much on managing PTSD. And some of the evidence-based treatments for PTSD include cognitive behavioral therapy, prolonged exposure therapy, cognitive processing therapy, or eye movement desensitization and reprocessing therapy, which is called EMDR. You may also want to consider talking with your family doctor about medications. Again, if you are experiencing significant symptoms of trauma, antidepressant medications can be helpful. And the medications I have listed here are some of the medications that are evidence-based medications that help with PTSD or trauma symptoms. So these would include fluoxetine or Prozac, paroxetine, which is Paxil, sertraline, which is Zoloft, or venlafaxine, which is Effexor. And finally, I want to just summarize some of the points that I want you, that I hope you'll take from this discussion today. One is that, cancer diagnosis and treatment can be considered a series of potentially traumatic events, and that while it's normal to have an emotional reaction to a distressing event, it's not necessarily normal some of the events that people experience when they go through cancer treatment and diagnosis. The majority of people experience their cancer treatment and diagnosis as traumatic, but only 4 to 6% of people diagnosed with cancer will actually meet that clinical level of trauma. Learning about the symptoms of trauma is helpful because I think it's going to help people understand more of what they might be experiencing. And again, we need to remember that the majority of people are probably going to experience some symptoms of trauma at some point during their cancer experience. Doesn't mean it's that clinical level, but they might experience some symptoms of trauma along the way. And knowing what those symptoms are and knowing how to cope with those may be particularly helpful. And being able to prevent some of the unhelpful patterns of behavior that can develop in association with trauma. And then finally, learning some of those effective coping strategies to help reduce symptoms of trauma. So I hope you have found some of these things helpful, and I'm going to turn it back over to Vanessa and answer any questions that you may have for me.
Thank you so much, Sheila, for that presentation. I think you covered a lot of really helpful points and strategies that people can use, and also validated a lot of the experience of the emotions that people feel when they are struggling with trauma. So I just wanted to say thank you so much for that presentation.